Good morning, class.
Good morning, sir.
How are you doing today?
We are fine, thank you. And you?
I am doing very well today by God's grace as well. We continue with our lecture this morning in Medicine and Medical Nursing 1. The course code is RGN 203. It is a 3-credit hour paper. Last week we discussed HIV/AIDS, and today we want to talk about hepatitis. Let's say hepatitis.
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 Once again, your lecturer, my name is Mr. Kwaku, Dwomoh. I have an MPhil in Human Anatomy and Cell Biology from KUST. I am currently pursuing my second master's degree, that is MPhil Nursing at the University of Ghana, Legon. I also have a Bachelor of Science Nursing degree from KUST in 2008. And I also have a diploma in education from the University of Education, Winneba Kumasi campus, now Amstead. I am a registered general nurse, currently at the level of Deputy Chief Nursing Officer or Deputy Chief Health User. And I am also the head of the Department for Nursing at the Nursing and Midwifery Training College, Dcno. So this morning, as I've already elaborated, that before you can understand any medical condition thoroughly, you need to go through this roadmap. So we want to talk about hepatitis. And first of all, we want to learn the definition of hepatitis. And because hepatitis talks about the liver, I will do a brief anatomy about the liver and the functions of the liver. Then we will learn the causes and the types, the various types of hepatitis, mode of transmission and incubation period for some of the types of hepatitis. We will also talk about the pathophysiology of hepatitis, clinical features, diagnostic investigations, medical and nursing management, and then we will end with prevention and control and complication. So, as usual, these are reading materials. After the lecture, if you want to go and do further reading, you can go to the main school's library, and then you pick your Brunner and Sadat's textbook for medicine and surgery by Henkel, Shiva, and Overbank, medical surgical nursing by Hoffman, medical surgical nursing by Lewis, clinical nursing skills and techniques by Porter Ostenbell, and essentials of pathophysiology and concepts of altered health states by Portier. So these are very good reading materials that you can go and pick from the main school's library, and then you do further reading. So let's all say hepatitis. Let's say hepatitis.
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 Hepatitis can be broken into two main words. Hepa. The word hepa means liver. Let's say hepa means liver.
Hepa means liver.
And then itis. Itis stands for inflammation. Let's say inflammation.
Inflammation.
So hepa means liver. And then itis means what? Inflammation. So basically, it means that we are going to talk about a disease condition where there is an inflammation of what? The liver. Hepa means liver, and that is the structure of a healthy liver on the body. Hepa means liver. Liver is the largest abdominal organ. The largest gland in the abdomen is the liver. It plays a lot of roles, and we all have only one liver. And so when there's an inflammation of the liver, that condition is termed as what? Hepatitis. So, as far as the definition of hepatitis is concerned, I'm saying that hepatitis is an inflammatory disease of the liver caused by viral infections. So there are a lot of viruses that can cause hepatitis. We have hepatitis A, hepatitis B, hepatitis C, D, E, and G viruses that can cause an inflammation of the liver. Hepatitis can also be caused by excessive alcohol consumption, that is alcoholic hepatitis. And then certain drugs and toxins can also lead to hepatitis, that is drug-induced hepatitis. And then from autoimmune reactions, it can also lead to what? An inflammation of the liver. And when there's an inflammation of the liver, it damages the liver cells, that is the hepatocytes. The liver cells are called hepatocytes. Let's say hepatocytes.
Hepatocytes.
Hepatocytes. The liver cells are called the hepatocytes. So when there is an inflammation of the liver, it damages the hepatocytes and leads to necrosis. Let's say necrosis. Necrosis simply means death of the cell. Death of the cell or death of the tissue. So as a result of the inflammatory reaction that occurs in the liver, there is necrosis and then there is autolysis of the liver cells. So hepatitis basically means an inflammation of the liver, either from excessive alcohol consumption, either from hepatitis A virus, B virus, C virus, D, E, or J viruses, either from self-medications or some drugs and toxins, or either from autoimmune reaction. And any of this can cause necrosis and autolysis of the hepatocytes. And when you have hepatitis, what are the cardinal clinical features? Remember I told you that for any medical condition, before you can really define it well, you need to add the cardinal signs and symptoms. So in hepatitis, there are two cardinal signs and symptoms. We have the clinical features under what we call the pre-icteric phase of the disease, and the clinical features under the icteric phase. The pre-icteric are the prodromal clinical features, and under that, we have low-grade fever, nausea and vomiting, abdominal pain on the right side where we have the liver, fatigue and malaise, headache, and anorexia. So these are some of the cardinal clinical features of hepatitis under the pre-icteric phase. Let's say pre-icteric phase.
Pre-icteric phase.
Pre-icteric phase.
Pre-icteric phase.
And then we also have jaundice, dark-colored urine, clay-colored stool, hepatomegaly, that is enlargement of the liver, splenomegaly, enlargement of the spleen, sclera icterus as the clinical features under the icteric phase of the disease. So anytime an individual has hepatitis or is being diagnosed of hepatitis, the clinical feature can be grouped under two main phases. The pre-icteric phase, where there are the prodromal clinical features, that is the nausea and vomiting, fever, headache, malaise, and all that. And then the icteric phase. So the pre-icteric phase of hepatitis is the stage without jaundice, and then the icteric phase of hepatitis is the stage with what? Jaundice. Now we are saying that hepatitis is an inflammation of the liver. So what it means is that you can only understand hepatitis very well when you have a very good understanding of what? The liver. So let's do a brief anatomy of the liver. I'm sure you've done that in Anatomy 1 already, but let's still do a quick review or a brief anatomy of the liver. So the liver is the largest gland in the body, in the abdominal cavity, as I've said. So that is the liver for you. It's the largest gland in the abdominal cavity. Brown in color, reddish brown in color, weighs between 1 and 2.3 kilograms. It is found in the upper part of the abdominal cavity. It starts from the right hypochondriac region, and then it moves all the way to the epigastric region, and some parts of the liver, that is the left lobe of the liver, also move toward the left hypochondriac region of the abdominal cavity. In Anatomy 1, we learned the 9 regions of what? The abdomen. So from the right hypochondriac, it comes into the epigastric region, and then it ends in what? The left hypochondriac. So that is the location of the liver in the abdomen. There are two main phases of the liver, the anterior surface. So that is the anterior surface of the liver, and this is the posterior surface of what? The liver. So at the anterior surface, you can see that it is very smooth, right? But the posterior surface is irregular. It is irregular. Now, there are two main lobes that can be found on the anterior surface of the liver. Let's say two main lobes.
Two main lobes.
So that is the largest what? Right lobe. Can you see that? So this whole bigger area of the liver is called what? The right lobe of the liver. And then the wedge-shaped smaller lobe is called the left lobe of what? The liver. Between the right and the left lobe, there's a ligament called the falciform ligament. Let's say falciform ligament.
Falciform ligament.
The falciform ligament is a mesentery that attaches the liver to the anterior abdominal wall. The falciform ligament is a mesentery that binds or attaches the liver to the anterior abdominal wall. And then when we look at the posterior surface of the liver, we can see that there are two major lobes that can be seen there. The caudate lobe, let's say caudate lobe.
Caudate lobe.
Caudate lobe.
Caudate
Then we
lobe.
can also see the quadrate lobe. Let's say quadrate lobe.
Quadrate
So
lobe.
the caudate lobe and then the quadrate lobe. Apart from that, some observations that can be made at the posterior surface of the liver is that there are some impressions where some abdominal organs lie. And as you can see, that is the gastric impression of the liver. The gastric impression is where the stomach, some part of the stomach lies. And then we also have the suprarenal impression. That is where the adrenal gland lies. And then we have the renal impression where the kidneys lie. We have the colic impression where the colon, the large intestine, some part of the large intestines are there. And then we have the duodenal impression where the duodenum there. And then again, at the posterior wall of the liver, we can also see the pear-shaped gallbladder that is found there. Can you see the gallbladder?
Yes.
Can you all see the gallbladder?
Yes.
And so the gallbladder can also be found at the posterior surface of the liver. Now, what is the function of the gallbladder? It stores bile. Let's say it stores bile.
It stores bile.
Now, one of the major functions of the liver is to produce bile. B-I-L-E, bile. The liver produces bile, and bile is for emulsification of fat. It breaks down fat into fatty acids and glycerol. And so when the liver produces the bile is moved into the gallbladder, for the gallbladder to store the bile. So that is a brief anatomy of the liver. What are the major functions of the liver? The first function of the liver is that the liver is responsible for carbohydrate and fat metabolism. Let's say carbohydrate and fat metabolism.
Carbohydrates and fat metabolism.
Yes, so breakdown of carbohydrate, breakdown of fat, and then even breakdown of proteins. So deamination and transamination of amino acids. Production and secretion of bile. I've already mentioned that the liver produces bile and then it is stored, the bile is then secreted and stored in the gallbladder. It helps also break down nucleic acids. That is the genetic material in DNA to form uric acid, which can now be excreted in urine. Uric acid is a component of urine. And then the liver is also responsible for the synthesis of plasma proteins or albumin, right? The liver is responsible for plasma proteins or albumin. And we know that albumin are responsible for maintaining the normal oncotic pressure of the bloodstream. And so when there is a damage to the liver, I'm taking you through the anatomy and the functions so that when we now move to talk about the disease hepatitis, where there's destruction of the liver, you can appreciate that, okay, if the liver is destroyed, then the liver cannot produce plasma proteins, the albumin. And therefore, automatically the oncotic pressure of the bloodstream is going to be affected, and that can lead to edema. So one of the cardinal complications of liver diseases is that it leads to ascites, where there's accumulation of fluid in the abdomen, and it is as a result of decreased oncotic pressure. The liver is also responsible for the synthesis of globulins and blood clotting factors. So blood clotting factors, right? So it means that if you have a liver disease, then clotting of blood can also be a problem, especially when you get an injury. Again, the liver is responsible for breakdown of red blood cells. And we know that when there is breakdown of the red blood cell, the hemoglobin breaks down all the way to become a bilirubin, right? And it is the responsibility of the liver again to convert unconjugated bilirubin to a conjugated bilirubin that can be excreted in the urine in the form of urobilin or urobilinogen, and then in the feces in the form of stechobilin or stechobilinogen. So when there's a disease of the liver, in the case of hepatitis, then the liver cannot break down old red blood cells, and that becomes problematic. Again, all the medications that we take, all drugs or medications that we take at the hospital, it is a responsibility of the liver to detoxify the drugs and all poisons and then bring out the drugs and the poisons out of the body. And so when there's a disease of the liver, detoxification of poisons and drugs will be a problem. The liver is also responsible for inactivation of hormone production of heat and storage of fat-soluble vitamin glycogen. So ADEK, vitamin A, D, E, K, they are the fat-soluble vitamins. The liver stores iron, copper, and that explains why as wives, when you are giving your husband normal meal in the house, you need to add liver, so that your husband will get iron, and then iron will help in the formation of red blood cell, right? Good. So that's why meals like the liver. So liver is for storage of iron as well, and then other vitamins like vitamin B12. And so I'm saying that if the liver is inflamed in hepatitis, the liver will not be able to perform all these functions that we've discussed. Carbohydrate metabolism, fat metabolism, protein metabolism, detoxification of drug, breakdown of red blood cells, and even production of what? Bile. So if there's a disease of the liver, before we even talk about the pathophysiology of hepatitis, I want you to appreciate the fact that from the normal anatomy, when there's an inflammation of the liver, destroying the liver hepatocytes, then the liver will not be able to perform all these functions. And if the liver cannot produce bile, then it means that when you take in fatty foods, it will deposit in your mucous membrane, and that can even lead to what? Jaundice. Is that clear? Good. Now, so what are the causes of hepatitis? Causes of hepatitis. We said that hepatitis comes from two words. Hepa, that means liver, and itis, that means what? Inflammation. Now, there are several causes of hepatitis. Anything at all that has the ability to enter into the liver and cause an injury to the liver can lead to hepatitis. But the commonest cause are the viral infection. Let's say viral infections. Viral infections are the commonest cause of what? Hepatitis. And we have hepatitis A virus, hepatitis B, C, D, E, and J viruses. All these viruses, when they enter into the bloodstream, they have the capacity to enter into the liver and cause an inflammation of the liver. And once the viral infection, hepatitis A, B, C, D, E, and J viruses are able to enter into the bloodstream, they lead to a type of hepatitis called what? Viral hepatitis. Let's say viral hepatitis.
Viral hepatitis.
So viral hepatitis is an inflammation of the liver caused by what? Viral infections. And at times even yellow fever virus, the flavivirus, can also cause an inflammation of the liver leading to hepatitis. Apart from that, autoimmune disorders. This is where your own body's immune system begin to attack the liver cells. Autoimmunity. Your own immune cells begin to attack what? The liver cell. And that type of hepatitis is called autoimmune hepatitis. Let's say autoimmune hepatitis.
Autoimmune hepatitis.
And then chronic alcoholism, long-term alcohol consumption. There are some people that are chronic alcoholics. Even when they take water the next day, they are drunk. The chronic alcoholics. Now, if you take alcohol frequently, consistently for a longer period of time, you stand a chance of having your liver being inflamed. And that condition is also known as what? Alcohol-induced what? Hepatitis. Let's say alcohol-induced hepatitis.
Alcohol-induced hepatitis.
Yeah, so in this case, for alcohol-induced hepatitis, the inflammation of the liver is caused by what? The alcohol. The alcohol toxins in the system. That has caused the inflammation of the liver. In this case, it is not caused by viruses, but it is caused by what? Alcohol. And then the last cause is from overuse of certain medications. And so here, the caution is on what? Self-medication. As nursing students, anytime we are sick, we always want to go to the pharmacy and buy our own drug without seeing the doctor for the right prescription to be done. And so if you are somebody who normally does that, you stand a higher risk of causing an injury to your liver. So overuse of certain drugs, medication, and toxins like rifampicin, Lagatil, Halotin, all these drugs, when you overuse it, it can cause an inflammation of the liver. And that type of hepatitis is what? Drug-induced what? Hepatitis. So depending on the type of injury causing an inflammation of the liver, if it is a viral injury, it is a viral hepatitis. If it is an alcoholic injury to the liver, it is what? Alcohol-induced hepatitis. If it is from autoimmune immunity, it is what? Autoimmune hepatitis. And if it is from abuse of certain drug, it is what? Drug-induced hepatitis. But whether the injury to the liver is coming from toxins or drugs, alcohol, or from the viruses, they all have the same what? Pathology or pathophysiology. They all end up destroying the liver hepatocytes. Are you okay? Yes. Good. So now let me just give you a smaller overview of the various types of viral hepatitis before I move to the pathophysiology. because we said that hepatitis can be caused by viral infections, excessive alcohol consumption, autoimmunity, or what, drugs. But when we pick the viral infection, we say that the viral infection is the most common type of what? Hepatitis. That is, viral hepatitis is the most common type of hepatitis. And most inflammation of the liver is being caused by the viral infection. So from hepatitis A virus, hepatitis B virus, hepatitis C virus, hepatitis D virus, E, and G. These are the common viruses that can cause an inflammation of the liver. So mode of transmission, the quickest way to remember is that A and E. Let's say A and E.
A and E.
So hepatitis A and E, the mode of transmission for A and E is fecal-oral route. Let's say fecal-oral route.
Fecal-oral route.
So hepatitis A and E, hepatitis A and E, their mode of transmission is by fecal-oral route. Is there anyone who can explain what is fecal-oral route? Is there anyone that can explain what is fecal-oral route? Okay, Ernest, explain fecal-oral. What is the meaning of fecal-oral route? Fecal-oral route. Fecal-oral. Just try. Just give it a try. Through the anus or the oral cavity. It simply means that if you eat food or drink water that has been contaminated with either hepatitis A or hepatitis E viruses, and the source of contamination could be like through the fecal matter, right? So from poor sanitation, right? Poor sanitation, poor environmental, and poor personal hygiene, when hepatitis A and E virus have access to fecal matter, and then it mixes up with the water that you are drinking or the food that you are eating. Once you eat that food or you drink that water that has been contaminated with the hepatitis A or E virus, then it can lead to what? Both hepatitis A and what? E. Are you okay? So hepatitis A and E is, the mode of transmission is what? Fecal-oral what? Route. And then hepatitis, the rest, all the rest. Hepatitis B, C, D, and G, all of them is through blood and blood-borne products. Let's say blood and blood-borne products.
Blood and blood-borne products.
Again.
Blood and blood-borne products.
So what do I mean by blood and blood-borne product? It means that, so these are the ways that are similar to the mode of transmission to syphilis, gonorrhea, HIV, right? So when you have unprotected sexual intercourse, and then there is exchange of what? Body fluids, semen, whatever, the probability that it can be transferred from one person to the other is high. Or you've been asked to go for blood transfusion. The doctor has requested that you should be given blood because you are anemic. And then the blood contains hepatitis B, C, D, or J virus. It can be transferred to you. Or like we said, when you go for tattooing, right? And then they use instruments on an individual that has hepatitis B, C, or D. And then the instruments are not sterilized well. And then those blood on the instrument contain the hepatitis B, C, or D, or J virus. When that instrument is not properly sterilized and it is also used on you in the process of tattooing, then automatically you can also end up having hepatitis B, C, D. But for all of them, the most common is what? Hepatitis B. Let's say hepatitis B.
Hepatitis B.
So the A and E is through fecal-oral route, and then B, C, D, and J is from what? Through blood and blood-borne product. What are the incubation period for all the various types of viral hepatitis? For the hepatitis A, it is 1 to 7 weeks with an average of 30 days. Hepatitis B, between 2 to 5 months. And if you have hepatitis B infection and it stays for more than 6 months, then you are at the chronic stage of the disease. Let's say chronic stage of the disease.
Chronic stage of the disease.
Hepatitis C is from 14 to 115 days, with an average of 50 days. That is the incubation period. Hepatitis D, 21 to 45 days. That's 3 to 7 weeks. Though it can be shorter in case of super infection. Hepatitis E, 2 to 10 weeks. So I'm talking about the incubation period for all the various types of viral hepatitis. So hepatitis E is 2 to 10 weeks, with an average of 5 to 6 weeks. And then hepatitis G is approximately between 14 to 20 days. What are the other names of all the viral hepatitis? For hepatitis A, it can also be described as infectious hepatitis or epidemic hepatitis. Hepatitis B is also known as serum hepatitis. Hepatitis C is the non-A, non-B hepatitis. And then hepatitis D is also known as what? Delta hepatitis. And we are saying that hepatitis D is a defective virus that only occurs in the presence of what? Hepatitis B. So before you can get hepatitis D, then it means that the individual is already having what? Hepatitis what? B. Hepatitis E is also known as enteric hepatitis. And then the hepatitis G is also known as the GB virus C or the human virus 1 hepatitis. And of course, hepatitis G is also relatively rare. It is not common. Like I said, the commonest is hepatitis B. The G is not common, and it's often found in connection with other hepatitis virus, similar to that of hepatitis D. Like we said, before you can get D, then it means automatically you are having what? Hepatitis B. So these are the various types of viral hepatitis, their mode of transmission, their incubation period, and then other names that we can use to call them. So this table summarizes all the various types of viral hepatitis. Now, what is the pathophysiology of hepatitis? Let's say pathophysiology of hepatitis.
Pathophysiology of hepatitis.
Again.
Pathophysiology of hepatitis.
Now, under pathophysiology, we are saying that when there's an injury to the liver, and we've learned that several factors can cause injury to the liver. Number one, viral infections can cause an injury to the liver, and that can lead to an inflammation of the liver. Number two, autoimmunity. Number three, toxins and certain medications or drugs. And then we said excessive alcohol consumption. All these can cause an injury to what? The liver. So when this injury happens to the liver, what are the series of processes that will happen to the liver cells before there will be permanent damage to the liver? And this process is what? The pathophysiology. Are you okay?
Yes.
Good. So hepatitis is a very fairly common disease that affects the liver. We've already established that fact. So if it is a viral hepatitis, then of course the injury to the liver is going to come from what? Either the hepatitis A virus, the B virus, the C, the D, or E. If it's alcoholic hepatitis, the injury or the damage to the liver is coming from what? Excessive alcohol consumption. And if it is drug-induced, the injury is coming from what? The medication, the adverse effect of the medication. But irrespective of the cause of the hepatitis, like I said, all of them have a similar liver damage. Their processes are what? The same. So whether viral hepatitis, alcoholic hepatitis, drug-induced hepatitis, they all cause an inflammation of the liver. Let's say inflammation of the liver.
Inflammation of the liver.
Now when there is an inflammation of the liver, the inflammatory process occurs in the whole liver. We mentioned the right lobe, the left lobe, the caudate lobe, and the quadrate lobe. So we mentioned the right lobe of the liver, the left lobe of the liver, the caudate, and the quadrate lobe. So all of these lobes have what? Cells, the liver hepatocyte. And when there's an injury, viral injury, alcoholic injury, autoimmunity, whatever be the injury to the liver, it initiates or starts an inflammatory reaction. And this inflammatory reaction affects all the liver what? Hepatocytes. Now the liver hepatocytes are therefore destroyed as soon as there is an injury to the liver, either from viral infection, alcohol, or abuse of drugs or whatever. The hepatocytes are destroyed from cytotoxic cytokines. Let's say cytotoxic cytokines.
Cytotoxic cytokines.
And then natural killer cells. And both of these are part of the inflammatory process. So the hepatocytes are destroyed by cytotoxic cytokines and natural killer cells. And that will initiate the inflammatory process. As a result of the inflammatory process occurring in the liver, it leads to what we call cellular necrosis. Let's say cellular necrosis.
Cellular necrosis.
Cellular necrosis.
Cellular
Now,
necrosis.
necrosis simply means death of what? The hepatocytes. Death. So the inflammatory reaction happening in the liver, caused by coming from what? The cytokines and the natural killer cells, is going to lead to what? Cellular necrosis. That is death of the liver cells or the liver hepatocyte. Now, if the inflammation also affects the periportal areas, it leads to cholestasis. Let's say cholestasis.
Cholestasis.
Where there is interaction to the flow of bile. We said that the liver produces bile. So the bile duct is going to be what? Occluded. And once the total inflammation of the liver hepatocyte is going to affect the bile duct. So the flow of bile is also going to what? Impede. And that process is called cholestasis. Now, the liver is the only organ in the human body that has the ability to repair itself. What did I just say? I said the liver is what? The only organ in the human body that has the ability to what? Repair itself completely. But when there is a total inflammation of the liver, especially coming from the viral hepatitis, the liver will now lose its ability. When in hepatitis, especially in viral hepatitis, the viruses makes the liver lose its natural ability to be able to what? Repair itself. And once the liver loses its ability to repair itself, then the complications will now set in. And there are a lot of complications as far as hepatitis is concerned. There's liver failure, liver cirrhosis. We are going to talk about. For every pathogen that enters into the human body, there's always antigen-antibody reaction. So in the case of the viral infection, the injury is a pathogen. So when the viruses enter into the body, there's going to be antigen-antibody reaction. This antigen-antibody reaction is also going to exacerbate or complicate the inflammation of what? The liver. And that will make the liver lose its ability to repair itself, and then the complications will now set in. But the complications will definitely begin with the initial prodromal signs and symptoms. Like I said, initially the person will begin to have what? Malaise, rash, fever, arthritis. So the prodromal signs and symptoms are the first cardinal feature that will present when there is initial damage to your what? Your liver. In addition, abnormal proteins begin to form within the body, and then they are being produced in the blood. These abnormal proteins are called cryoglobulins. Let's say cryoglobulins. And when the cryoglobulins accumulate in the blood, it results in what we call cryoglobulinemia. And all of this complicates the inflammatory process of the liver. So in hepatitis, there are two main stages of hepatitis. We have what we call acute hepatitis and then what? Chronic hepatitis. For chronic hepatitis, it means that the individual have lived with the condition for more than what? 6 months. Now, as far as the pathophysiology of hepatitis is concerned, the clinical feature presents under 3 main phases. Let's say 3 main phases.
3 main phases.
3 main phases.
3 main phases.
The first phase in the presentation of the clinical features is called the pre-icteric phase. Let's say pre-icteric phase.
Pre-icteric.
That is the prodromal stage of the condition where there is no jaundice. The stage without jaundice. The stage without jaundice. So at this stage, the individual only shows the prodromal signs, the nausea and vomiting, the headache, the fever, but at that stage, the individual has not yet developed jaundice. But when the disease progresses, and then there's massive destruction of the liver hepatocyte, then the individual will begin to have what? Jaundice. And the stage with jaundice is called the icteric phase. Let's say icteric phase.
Icteric phase.
Icteric phase.
Icteric phase.
That is the stage with jaundice. The icteric phase is the stage with jaundice. Now, the last stage is when the individual is able to have an improvement in the disease condition, and when there is an improvement, the individual now moves to what we call the recovery phase. Let's say recovery phase.
Recovery phase.
Recovery phase is when there is an improvement in the condition. So under the prodromal stage or the pre-ecteric phase, the clinical features are malaise, fatigue, anorexia, nausea, vomiting, cough, low-grade fever, and in this stage of the disease there is no what? Jaundice. Now at the ecteric phase, that is the stage with jaundice. And then at the ecteric phase there may be hepatomegaly, that is enlargement of the liver, splenomegaly, enlargement of the spleen, and the individual also present with what? Jaundice and even scleral icterus. And then finally, the recovery phase of the disease, like I said, is when the individual is recovering from what? The disease. So now the signs and symptoms will start to diminish, and it normally occurs about 2 to 12 weeks after jaundice was disease. Now, if an individual begins to have hepatitis within the acute phase, and then it's not being properly managed, then from the acute stage, the individual will now progress towards the chronic stage of the disease. At the chronic hepatitis stage, there is persistence of clinical manifestations, and then the liver inflammation happens after the acute stage. And say that the liver function test remains abnormal longer for 6 months. So once you do liver function test and the values are always abnormal consistently for more than 6 months, then we can now diagnose you as having what? Chronic what? Hepatitis. That means that there is a massive destruction of your liver cells coming from any of the injuries, either from viruses or from what? Toxins. Now, at the chronic stage of hepatitis, the chronic hepatitis stage, the individual may develop what we call vasculitis. Let's say vasculitis.
Vasculitis.
That is inflammation of what? The blood vessels. There can also be glomerulonephritis. Vasculitis may come from the abnormal the cryoglobulins, and when they stay in the blood vessel, they can cause an inflammation of what? The blood vessels. That is vasculitis. So glomerulonephritis, where there's inflammation of the glomerulus within the kidney, and then it can also advance to hepatocellular carcinoma, that is cancer of what? The liver, and then cirrhosis of the liver as well, liver failure, and then chronic liver damage in the advanced stage of the disease. So overall, what do we want to say as far as the pathophysiology is concerned? We are saying that in summary, when there is any injury to the liver, either from viral infection, autoimmunity, abuse of certain medication or toxins, or from chronic alcohol consumption, these injuries will start an inflammatory process in what? In the liver. During the inflammatory process, there is cellular what? Necrosis. That is death of the tissue. Now, as the tissue begins to die, then worsening clinical features will follow. But before that, we've also established the fact that the liver is the largest gland in the abdomen that has the ability to what? Repair itself. But when there is massive destruction to the liver cell, especially coming from the viral hepatitis, it disables the liver's ability to repair itself. And then once the liver may not be able to repair itself, then the complications will not set in. Where we are saying that the individual will develop what? Vasculitis, glomerulonephritis, hepatocellular carcinoma, cancer of the liver, liver cirrhosis, and what? Liver failure. So that is the pathophysiology of what? Hepatitis. Now, as far as the clinical features are concerned, I've already highlighted that for the clinical feature, there are 3 main what? Stages or 3 main phases. The pre-ecteric stage. So, in the end of semester, when I ask you any question on hepatitis, and I want you to give me clinical features, I will be specific that maybe give me 5 clinical features under the 2 main phases of what? Hepatitis. And the 2 main phases are what? The pre-ecteric phase and the what? The ecteric phase. So under the pre-ecteric phase, we said that is when the initial signs and symptoms what? Begin at the acute stage of the infection. So at the pre-ecteric, we have low-grade fever, headache, malaise, anorexia, lassitude, that is complete exhaustion, either physical or mental exhaustion, generalized itching, nausea and vomiting, diarrhea, indigestion, joint pain, rashes, general body itching like pruritus, epigastric distress, heartburn, flatulence, and then strong aversion to strong odor. All these are clinical features only under what? The pre-icteric phase. Then we have under the icteric phase, that is the stage with jaundice. The clinical features are hepatomegaly, that is enlargement of the liver, splenomegaly, enlargement of the spleen, jaundice, dark colored urine, light colored stool, enlarged posterior cervical lymph nodes, liver tenderness, palpable spleen, and then scleral icterus. So these are the clinical features under the icteric phase of what? Hepatitis. And I've said that the icteric phase is the stage with what? Jaundice. So once again, like I said, in the end of semester or in any examination, if we want you to give us clinical features of hepatitis, automatically we would want you to group them under what? The pre-icteric phase and then what? The icteric phase. The pre-icteric is what? The prodromal phase, at the acute stage of the disease. And then the icteric phase is what? At the chronic stage of what? And where jaundice appears. Now the recovery phase of the disease, we say that jaundice starts to clear or begins to decline, usually about 6 to 8 weeks after exposure. The liver stays enlarged, tender, but other symptoms begin to diminish. And then the liver gradually begins to regain normal function under the recovery phase of the disease. What are the diagnostic investigations for hepatitis? Of course, for every medical condition, observation of the cardinal clinical features is a diagnostic feature. Apart from that, liver function test. Let's say liver function test.
Liver function test.
So liver function test, liver biopsy, laboratory investigation for full blood count, laboratory investigation for serum bilirubin levels. Now when there is more bilirubin depositing in the mucosal membrane, that will lead to what? Jaundice, right? So you need to check for bilirubin levels goes in the blood. And then in the case of hepatitis B infections alone, you can do what? Hepatitis B surface antigen serological test or hepatitis B profile test. The last two diagnostic investigations are for only what? Hepatitis B what? Infection. But for every hepatitis, the commonest one that you can do is what? Liver function test. Let's say liver function test.
Liver function test.
Now, how do we manage somebody with hepatitis medically? So medically, management is based on the cause. We say that hepatitis A can clear on this cause, but for all the viral hepatitis, the medication that is normally prescribed for those patients are antiviral medications. Let's say antiviral medications.
Antiviral medication.
Antiviral medications.
Antiviral medication.
And then in the case of hepatitis A and B, you can also give what? Vaccinations. Now, the key information about vaccination, or the key notes, or the key points about vaccination is that before you are vaccinated, you need to be tested for those conditions. Maybe it's hepatitis B, you need to be what? Screened and tested, whether you are positive or what? Negative. If you are negative for hepatitis A or B, then you can be given what? The vaccination to protect you from getting what? The disease. But if you are positive, there will be no need to what? Vaccinate you. Is that correct? So the vaccines only come after you have been what? Screened or tested for the condition. If you are negative, then you can be given what? The vaccination. And then again, lifestyle changes is very important, especially for alcohol-induced hepatitis. The person will automatically have to what? Stop alcohol consumption or reduce excessive alcohol consumption. And then in the case of drug-induced hepatitis 2, we will need to what? Avoid certain toxins or avoid self-medication, and so that we will not take a medication whose adverse effect will not go and cause an inflammation of what? The liver. How do we manage our patients on the ward? So nursing management. I've already highlighted in our introductory class that all nursing management is based on what? The presenting signs and symptoms. So you look at the clinical feature, and then you manage it using the clonidipine. So for under the chronic therapy, we have low-grade fever. So which aspect of the general nursing management do we employ? We do what? Monitoring or observation. So we do vital signs, right? And once we check the vital signs and the temperature is above 37.2, then we say that the patient is having pyrexia. Let's assume that the temperature is 39.5. That's pyrexia. So you do what? Tepid sponging. How do you do it? You use a tepid water and then your flannels or small towels, and then you tepid sponge the patient, putting one flannel on the forehead, two in the armpit, two in the groin, and then you apply one on the whole body to help reduce the body temperature by 1 degree Celsius. And then you also give antipyretics to help reduce the body temperature by 1 degree Celsius. For headache, rest and sleep psychological anti-diversional therapy, application of cold compresses to the forehead, and then analgesics are given to relieve patient of headache. The same thing applies to malaise, lassitude, and generalized aching. So body aching, rest and sleep. Because as you sleep, it conserves energy. It helps to conserve energy and relieve patient of what? The body retreat. And then still under malaise, the patient is encouraged to take in well-nourished, and that contains a lot of calories, right? Because calories provide more energy, and it will help relieve the patient of the body retreat. Anorexia, mouth care is very key. And then again, under nutrition for anorexia, what do? You plan the diet with the patient, dietitian and the nurse. And once you are planning the diet with the patient, the dietitian and nurse, it will help stimulate appetite for the patient. You serve patient with a well-nourished that rich in all the essential nutrient, protein, vitamins, and all that. But in the case of hepatitis, it should be a low-fat diet. Do you agree? Let's say low-fat diet.
Low-fat diet.
Why low-fat diet? Because there's an inflammation of the liver, and then production of bile is what? Limited. And we know that if you take in high-fat diet, it is the bile that will have to break down the fat. But because there's an injury to the liver, then the individual should be allowed to take what? A low-fat diet. Nausea and vomiting, mouth care, personal hygiene, that is, you give a vomit bowl to the patient to always vomit inside, then you cleanse the mouth. And then because of vomiting, to prevent dehydration, IV fluid therapy. So prescribe IV fluid therapy, and then antiemetics are also given to stop the vomiting. For diarrhea, store IV fluid to prevent dehydration. You monitor the patient, that is on the intake and output chart, right? Balance it every 24 hours to see whether the patient is having fluid retention or dehydration. And personal hygiene is also key in diarrhea. That is, after every diarrhea episode, the person has to wash their hands. If they need to change the bed linens, especially the fecal matter dropped on the bed linens, you need to ensure personal hygiene. And then anti-diarrhea medications are also given. For indigestion, medications, nutrition, cerebral fluids are important. Joint pain, psychological care, that's diversional therapy, rest and sleep. And then still on the joint, application of warm water compresses on the joint to relieve the patient of the joint pain. Rashes, medications, general body itching, medications, pediatric district medications are given. Heartburns, also you need to give medications. Flatulence, high fiber diet, liberal fluids, and then medications as well. And then strong aversion for certain odors, then there will be a need for barrier nurse. If the person cannot tolerate certain odors, you need to isolate the patient and keep the patient in a separate room. Under the enteric phase, the patient is having enlarged liver, enlarged spleen, and then the patient is also having jaundice. So of course, it can bring anxiety, right? So psychological care is very important. And then you also continue to serve the prescribed medication. But once you give the antiviral medication, it is going to help in the recovery process of the patient. And that will help also reduce the enlargement of the liver. And then of course, rest and sleep is also very important. And then observation, so especially with the jaundice, you observe the mucosal membranes for yellowish of the eyes or the palms and the soles of the feet. And then you report any abnormality to the next child. For dark colored urine, light colored stools, so observation is key. So you observe the color, the odor, the amount, and the consistency of the urine and then the stool. then you report any abnormality to the nurse in charge. And then you also give more liberal fluids, send your medication, and then psychological care. For the patient is worried that the urine color has what changed, you need to what reassure the patient that with appropriate management, the urine color will now be what will be normal. With an enlarged posterior cervical lymph node, medication is also very key, and then psychological care as well, and then rest and sleep. Liver tenderness, palpable spleen. You also have to ensure psychological care because the liver is tender. The patient can palpate his or her spleen, right? Where is the spleen? In the left part, right? So the liver, the spleen can be palpated. So what do? The patient can palpate his or her spleen. You need to reassure that with appropriate measurements, the patient will be what? Will be fine. And then you send your prescribed medications as well, and the rest and sleep is very important. And then with the sclera interus, observation, you observe the sclera for any abnormality and report to the nurse in charge. You send the prescribed medication. You also encourage maximum rest and sleep in the patient, and then psychological care is very important. Now, how do we prevent hepatitis? Prevention and control. It also depends on the type of hepatitis. Of course, if the cause of hepatitis is alcohol induced, the only prevention is what? Stop taking alcohol. If it is drug induced, the prevention is what? We stop the self-medication. But if it is from viral hepatitis, especially hepatitis B, C, D, where the mode of transmission is from blood-borne products, blood and blood-borne products, then the ABC prevention will come in again, right? So for hepatitis B, C, D, ABC prevention comes in. And what are the ABC? Abstinence, be faithful to your partner, and then wear a condom during what? Sex. Because we know that unprotected sexual intercourse can transfer the virus, the hepatitis A, B, the B, C, or D viruses. And then good personal hygiene. Good personal hygiene for what? Hepatitis A and E. Fecal-oral route, right? And then proper environmental hygiene. Also for hepatitis what? A and E, the one that is transmitted through the fecal-oral route. Effective sterilization technique for hepatitis B, C, and what? And D. And then you dispose syringes and needles after collecting blood samples. So for hepatitis B, C, and D, the one that is transmitted through blood and blood-borne products. Screening of blood before blood transfusion to prevent hepatitis B, C, and what? D. And then vaccination, yes, it's very important. But we learn that once you take the vaccines, it will help you to be able to protect you from getting the disease. And then screening of food handlers is under hepatitis what? A and E, right? Because if the food handlers are having hepatitis A or E, and then after passing through, they don't wash their hands, they come and serve you with their bare hand that contains the hepatitis A or E virus, and then you're watching that you go and buy it very cold, and after enjoying the watching, it can be transferred to you as well. And then generally health education of the general public about it. So that is the prevention and control about hepatitis. Complications of hepatitis, we said that when either the viruses, the alcohol, the drugs, the toxins, when they cause massive injury or inflammation to the liver, cellular necrosis, vasculitis can lead to liver cirrhosis. Let's say liver cirrhosis.
Liver cirrhosis.
So liver cirrhosis is a complication of hepatitis, cancer of the liver or hepatocellular carcinoma, liver failure, total failure of the liver, ascites where there's accumulation of fluid in what? The abdomen, from decreased onboarding what? Pressure. And then edema, still coming from what? Because that the liver produces plasma proteins. And so if the liver is damaged, you may not be able to produce the plasma proteins. And when there's low plasma proteins, it results into hypoalbuminemia, decreasing the onboarding pressure, which leads to leakage of fluid from the bloodstream toward the interstitial fluid spaces, and that will lead to what? The edema. And then hepatic encephalopathy, that's where toxins accumulate in the blood, affecting the brain, causing confusion, delirium, and coma. And then portal hypertension. So these are the complications of hepatitis. These are our references for our lecture, and that is the end of the lecture. Any question on all that we have done on hepatitis? Any question on hepatitis? All right, Samuel, what's your question?
So my question is for the viral, the most common hepatitis is the hepatitis B.
The hepatitis B, yeah.
Yes, you made mention of it is being transmitted through blood and bloodborne products.
Blood and bloodborne
So I wanted to ask with the mother, from the mother to the child.
vertical transmission.
Vertical transmission. You see, for HIV, it determines the viral load. So this one, is there any maybe circumstances that maybe the mother can pass to the baby, or like you see for HIV it's determined by the viral load. So
Yeah.
this one, is it that when the mother is having hepatitis B, definitely the child is going to have hepatitis B, or there are medications that are going to suppress the number of virus in the mother's body, which will prevent the baby from getting the hepatitis.
The hepatitis B. Okay, very good question. Yes, for hepatitis B, for the viral diseases, it is not curable. So for hepatitis B, when the mother has hepatitis, the chances of transferring to the child is very high, very, very high. And nowadays, even though there are antiviral medications, but some of the medications are able to help the individual recover. But most of these medications too are not able to do that. That is why you need to constantly do the liver function test. Okay? So what I can say is that generally, if the mother is diagnosed with hepatitis B, there is a higher chance that the mother, research has shown that there is a higher chance that the mother can transfer it to the baby in utero. So vertical transmission is possible. Yes, any other question?
Yeah, please. My name is Eric Mills, Kakapu.
Mills, yes.
So please, under the diagnostic purposes,
Diagnostic investigations, okay.
I want to know if someone does a big investigation and the result is showing reacting.
That's
does it mean-
positive.
Okay, that means that the person is having, he or she is now exposed to the virus.
Once you are reactive or positive, it means you have the hepatitis B virus in your bloodstream. That is why you will be positive. So once you are reactive or positive, you are positive. Okay. Any other question? Yes.
I'm Derek.
Derek.
Please, my question is about the causes of the hepatitis.
The causes of hepatitis, yes.
You made mention that there is some autoimmunity.
Autoimmunity.
Yes, sir.
Uh-huh.
When the antibodies.
Your own immune cell begin to attack the liver cell. Yes.
What are the trigger factors that be the cause factor for the antibodies to attack
He wants to know the precipitating factors for autoimmunity. That is genetic abnormalities, right? It could be chromosomal abnormality. Some people are born with certain abnormality that facilitate what autoimmunity. Certain genes are responsible for the autoimmunity. So that is what I can say concerning the autoimmunity. So if you are born with a certain gene that can cause autoimmunity, then you can stand a higher chance of getting autoimmune hepatitis. Any other question on hepatitis? Yes? Barbara. Barbara what?
Barbara
Kessie, Barbara. What's your question?
My question is, if a patient presents with high-grade fever, nausea and fatigue, and at the same time presents jaundice and that fluid, under what state can we classify this?
The patient has what? Fever?
Nausea.
Nausea and vomiting.
And at the same time,
Having
dark urine and jaundice.
dark colored urine and jaundice. You want to know the stage?
And where we can classify that.
Okay, so once the jaundice comes in, you are the ecteric phase of the disease. But it also depends on the number of months that you've lived with the condition. That's why we say that you need to do frequent liver function tests. So once you do frequent liver function tests, and the results is not is nothing to write home, meaning that it is not encouraging. The results is always bad, consistently for 6 months. Then you are at the chronic stage. So the emphasis is on the 6 months. But once the jaundice sets in, it means that you are moving to the chronic stage of what? The disease. Once jaundice sets in, it means that there is massive damage to what? The liver hepatocytes. And then you are moving to the chronic stage of what? The disease. Alright. Any other question? So on this note, we come to the end of the lecture, and God willing, next week we'll continue from other disease conditions. Thank you very much and have a lovely day.